The CDS 9000 small animal anesthesia machine is designed to be used on veterinary patients by trained veterinary professionals. The CDS 9000 machine is easy to assemble. You may refer to the operations manual for complete steps on assembly and operation. This video will help demonstrate the proper setup of the CDS 9000 anesthesia machine. The pole mount configuration comes with a pole that is tapered to fit snugly into the machine base. Please note that if you also purchase the double E-tank rings, you will want to center the rings appropriately and secure them in place prior to mounting the machine head. Secure the angle arm to the machine head and fasten it to the pole using the long button screw, then tighten. Attach an empty vaporizer to the machine head by using the hardware provided with the vaporizer. It is helpful to have a second pair of hands when mounting a vaporizer. Place the locking washer, then the flat washer onto the mounting bolt. Slide the bolt through the slots on the machine and place the white nylon washer onto the bolt. Align the vaporizer with the bolts and tighten with a 10mm wrench to secure the vaporizer. Secure the end caps to the vaporizer. The tapered end caps will fit securely into the vaporizer. Tighten them gently by twisting upward into place. Once a vaporizer is secured to the anesthesia machine, it can be filled with the appropriate anesthetic agent. A fill adapter will help reduce spills. It is recommended that the newly filled vaporizer sit overnight before it is used on a patient. This allows the internal wick to adequately absorb the agent to ensure proper function of the vaporizer. Place the draw knob screw into the screw port of the black divider. This prevents granules and/or dust from entering the threads and causing an obstruction of a proper seal. Fill the absorber canister with absorbent up to 1/2 to 1 inch from the top of the canister. Once filled, remove the draw knob and align the canister underneath the head of the machine. For proper alignment, the canister has a guide pin that must be seated in the provided guide pin slot under the machine head. When tightening the canister in place, finger tighten only to avoid damaging the canister. Secure the pop-off occlusion valve onto the pop-off valve. Attach the 19mm waste gas scavenging tubing and connect it to the waste gas evacuation system. The CDS 9000 machine is designed to work with a variety of delivery gases. The delivery gas is connected to the flow meter on the back of the machine using the appropriate DISS connection. The delivery gas source and the flow meter should both be in the off position during this connection. Prior to use, confirm the gas delivery is properly connected and regulated with a line pressure of 50 to 55 psi. The flow meter is located on the far left side of the machine head. It controls the delivery of oxygen into the system. The standard flow meter reads from 200 milliliters to 4 liters per minute. The ball float, located inside the Thorpe tube of the flow meter, displays the amount of delivery gas being delivered to the system. It should be read at the center of the ball, not above or below. The flow control knob should be turned off, clockwise, when not in use. Do not over-tighten, as this can damage the needle valve and torque guard, affecting flow regulation. The oxygen flush valve is located above the flow meter. This button delivers oxygen only at a rate of 10 to 15 liters per minute. The flush valve is used to pressurize the system during the machine leak testing procedure or to flush the system after a procedure. It is not recommended to use this function while a patient is attached to the anesthesia machine, as it may result in patient injury. Delivery gas from the flow meter is diverted into the vaporizer, creating the anesthetic gas mixture being delivered to the patient. Silicone tubing carries fresh gas from the vaporizer into the aluminum block and exits the fresh gas outlet, which is located between the inhalation and exhalation valves. The gas then re-enters the machine for rebreathing systems via the fresh gas inlet, which is located on the underside of the block. On the front of the machine sits the unidirectional inhalation and exhalation valves. This is where rebreathing patient circuits are attached. Located on top of the machine head, behind the exhalation valve, is the pressure manometer. The manometer is a gauge that measures the pressure within the system. It helps to guide assisted breaths and is used during the anesthesia machine leak testing procedure. The manometer should be inspected daily for proper alignment. The needle should rest at the 0 mark when not in use. Below the exhalation valve, on the underside of the machine, is the patient bag port. This port is used to connect a breathing bag or ventilator hose connection to the machine. The absorber canister is located behind the bag port. This canister holds the absorbent that removes CO2 from the recirculating anesthetic and oxygen. Behind the manometer is the pop-off valve. This adjustable valve directs waste anesthetic gas from the machine to the scavenging system. The unique feature of the Surgivet pop-off valve is that it will passively hold 2 centimeters H2O pressure in the system when in the fully open position. This maintains a passive volume in the breathing bag. The pop-off occlusion valve connects to the outlet of the pop-off valve. By depressing the occlusion valve button, gas is blocked from exiting the pop-off valve so that a manual breath can be given to a patient. Upon release of the button, pressure is released from the system. 2 breathing circuits are included with the anesthesia machine, a rebreathing and a non-rebreathing style. The rebreathing circuit features coaxial tubing for patients weighing greater than 7 kilograms. The breathing bag is connected to the bag port located under the exhalation valve. The non-rebreathing circuit bypasses the inspiratory-expiratory valves and CO2 canister. To connect to the anesthesia machine, locate the fresh gas outlet on the front of the machine between the 2 valves. Remove the 15mm adapter from the block. Locate the fresh gas adapter of the non-rebreathing circuit and connect it to the fresh gas outlet. The anesthesia machine should be evaluated daily, and inspection of parts should be performed. A pressure test is also recommended prior to each patient or whenever a component of the breathing system is changed. Daily machine leak test. The daily machine leak test is recommended to be performed at least once a day, ideally before each procedure or when circuits are changed out. Confirm the CDS 9000 machine is appropriately connected to an oxygen supply, the delivery gas supply is turned on, and the regulator is set at 50 to 55 psi. Confirm flow meter operation. Ensure that the flow valve operates smoothly and that the ball moves freely within the Thorpe tube. Check to ensure the vaporizer is adequately filled with its respective agent. Connect a rebreathing circuit, such as a Y or F circuit, to the inhalation-exhalation valves. Connect a rebreathing bag to the bag port of the machine and ensure proper configuration and secure connections. Check that the waste gas scavenging system is properly connected to the CDS 9000 machine. If you're using an active evacuation system, make sure it is turned on. Pressure test. Start by closing the pop-off valve, finger tight, without over-tightening. Occlude the patient circuit with your finger and fill the rebreathing bag by depressing the O2 flush valve. Do not turn on the flow meter during this test. Continue to depress the O2 flush valve until the pressure on the manometer reads 25 to 30 centimeters of water. Then release the flush valve button to discontinue flow. The pressure should not drop more than 5 centimeters of water in 10 seconds. Ensure that the pressure holds steady. If it does not hold steady pressure and continues to decrease, this indicates a leak in the system. Turn the dial on the O2 flow meter up to compensate for the leak, and use a soapy water solution to spray on the machine parts to locate the leak. Use a dry towel to wipe the areas after spraying. After your CDS 9000 machine has passed the leak test, make certain you relieve the pressure by opening the pop-off valve. Common places to check for leaks: inspiratory and expiratory valves and dome caps, CO2 absorber canister. Check for granules in the screw hole of the divider or under the CO2 absorber gasket on the underside of the machine head, or cracking, chipping of the canister. Ensure the guide pin is correctly aligned with the guide pin hole on the underside of the machine head. Fresh gas outlet. Pop-off or relief valve. Around the vaporizer, end caps or silicone tubing. Check for holes in the rebreathing bag or patient circuit hoses. Maintenance schedule. The CDS 9000 anesthesia machine is easily maintained in the field. Preventive maintenance and daily leak tests are recommended. A pressure test is recommended to be performed at least once a day, ideally before every procedure or when circuits are changed. Refer to the daily machine leak test portion of this video or the laminated card enclosed with your product on how to appropriately perform this on the SurgiVet anesthesia machines. Inspect the patient's circuits, hoses, and rebreathing bags daily or before each use for proper function and visual damage. These items can be cleaned with a mild soapy water solution. Be sure to thoroughly rinse and dry them completely. The machine surfaces are recommended to be cleaned with a soft cloth and a mild soapy water solution daily, rinsed and dried completely. The carbon dioxide absorber canister should be cleaned as needed between changing out the absorbent granules. The canister should be cleaned with a mild soapy water solution, rinsed and dried completely. The gaskets to the canister should be visually inspected weekly for wear and damage. Clean as needed with a mild soapy water solution, rinse and dry completely. Change the absorbent as needed according to the manufacturer's directions. Leave 1/2 to 1 inch space between the granules and top of the canister to allow proper flow of gas through the canister. The flutter discs in the inhalation and exhalation dome caps should be inspected weekly for any visual damage, warping, or discoloration. If any of these are observed, they should be replaced. Clean with a mild soapy water solution, rinse, and dry completely. Inspect the pop-off valve daily to ensure that it completely opens and closes smoothly with no problems. Inspect the pop-off occlusion valve daily, if available, on the anesthesia machine. Ensure that the spring-loaded button moves up and down smoothly. If there is any resistance or questionable function, remove it from use and replace if necessary. The scavenging system should be evaluated daily to ensure proper function. If using the EnviroPure canisters, weigh the canister daily and log the weight gain in grams. Dispose of the canisters according to the manufacturer's directions. Check the integrity of the evacuation tubing by visual inspection and by performing a pressure test on the anesthesia machine. Ensure that the manometer needle moves smoothly and will land at 0. Thank you for viewing this clinician training program. For further troubleshooting assistance or additional questions or information, please contact SurgiVet Clinical and Technical Support at 800-258-5361.